Hello, I'm Dr. Azura from Careclinics Group. Today, I want to demonstrate how to do CPR on adult. Most of the cases, if you come across this victim lying down on the floor, unconscious, in adult, most likely due to cardiac arrest or heart problem. First thing, when you arrive at the scene and you see this patient lying down on the floor and you're not sure what's happening, so important thing is to assess the situation. First, you have to check the surrounding. Make sure that there is no danger around the patient and no danger for you. If there is any live electric wires around, you have to remove that. If any sharp objects around, you need to remove that also, and make sure there's no toxic fume in the area. Next, what you need to do is to check the patient responsiveness. How you're going to do that is you have to shake the patient's shoulders and say, hello, 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 are you okay? Hello, hello, are you okay? Hello, hello, are you okay? Wake up, wake up, wake up. At the same time, when you check the patient response, you need to check the victim breathing or the patient breathing. What you need to do, check whether the chest is any chest movement to see if the patient is breathing. Check if there's any air movement from the mouth and nose. This is very important to check whether the patient is breathing or not. Alright, let's say there's no response and the patient is not breathing. Next, you need to call it. I mean, you need to shout for help. If there is other people around in the area, you need to call it. Maybe you have to point out to that person. If you know their name, you have to mention their name. Let's say, hello, Mr. Ali, can you call the ambulance? Or, hello, Mr. Ahmad, can you call 999? Or, hello, Mr. Hamid, if you can see the AEDs around and bring it here. That is call for help or shout for help. Let's say you are alone, there's nobody around, and you have your phone around you, you have to make a call. Yeah? Maybe you can put in a speakerphone, put beside you, and call the operator, call 999, and maybe you say, hello, my name is Azura and I'm from Clinic Serinda. My address is number 26, Jalan SC14, and I have a victim here, who's unconscious, and there's no response and there's no breathing. I know how to do CPR, I'm going to do CPR now. So that's shout for help. Right. The next one is you have to remember CAB. C is compression, A is airway, B is breathing. So this is you have to act very quick in order to save this patient. C, that means you know the patient is not responsive and there's no breathing. You have to start with the compression. So how you do compression in CPR? You need to use the heel of your hand over here and fingers interlock like this, and make sure you use the heel of your hand and place it at the center of the victim's chest. The location is around 2/3 from the sternum and is in between the two nipples, and you need really to press down. The depth is around 5 to 6 centimeter in depth, and the rate is around 100 to 120 compression per minute, so it's around 1 to 2 compression per second. So you really need to press deep and press hard and press fast, right? And make sure you don't lean on the patient's chest to allow the complete recoil of the chest after each compression, and make sure you don't stop in compression after you allow the chest to recoil. And the ratio for CPR is 30 compression to 2 rescue breaths. So the hand placement is over the victim chest, and make sure your arm or straight, and your shoulders is above the patient's chest like this. So what you need to do is press down, press hard, and press fast. So I demonstrate now how to do the CPR. And while doing that, you may need to count loud so you won't lose count. Right? We'll start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So 30 compression. After that, very quick, you need to give rescue breath. How you do that? How to give rescue breath? Yes, you need to do the open the airway. You know how you open the airway? You have to do the head tilt and chin lift. When you do that, automatically the airway will open. And you need to give 2 rescue breaths. How you do that? You have to pinch the nose and put your mouth around the victim mouth and give 2 big breaths. Let's say if you have a pocket CPR mask like this, so you put around the patient nose and mouth and give the full breath like this. 1 breath around 1 second, so very fast you need to do it. And after that, you continue with your compression. Another 30 compression and followed by 2 rescue breath. And you need to do this for 5 cycles. After 5 cycles, you can check the patient pulse by feeling at the carotid pulse at the neck area. Let's say if the patient is breathing spontaneously now, and you can feel the carotid pulse, then you need to put the patient on the left lateral position or the recovery position. Alright? Let's say the patient, when you check after 5 cycles, you cannot feel the pulse and there's no spontaneous breathing, then you need to continue with CPR. You keep doing that non-stop until the ambulance arrives or you have AED to give the patient a shock. Right? Let's say you have assistant, 2-man CPR, 2-person CPR. You need to, it's possible to switch roles. It means after you do compression, then you switch to take care of the airway, and then vice versa. This one to avoid from feeling tired. Let's say in a situation whereby you're not sure if the patient has COVID, or you're not sure the medical history of this patient, or you see the patient has 40 mouths, or you don't have any barrier devices around, like you don't have this pocket mask with you to help with the rescue breath. You don't need to give rescue breath. What you need to do is continue with your hand only CPR until help arrives. That's all. Thank you very much for watching this video.
Visit careclinics.com.my to find out more about us.